The Prime Minister has dubbed it her year of delivery, and today she landed a significant agreement. After a long gestation, a deal has finally been done on health funding, satisfying all the state governments. With that under her belt and relief that the Reserve Bank had kept interest rates on hold, Julia Gillard tonight met senior executives and editorial staff at News Limited's Sydney headquarters. Political correspondent Tom Eagleton reports from Canberra.
Into the lion's den.
Are you going to tell him to stop writing crap, Prime Minister?
Hello. Good evening, Prime Minister. What topics do you expect to cover this evening?
Thanks very much. Nice to see you here.
The Prime Minister provoked a storm at News Limited when she linked it with its disgraced sister company News International, saying the Australian operation had questions to answer following the phone hacking scandal in the UK. Now, News Limited boss John Hartigan's gathered his editors around for a chat with the Prime Minister.
Such meetings have been addressed by Prime Ministers and opposition leaders in the past, so when I was invited by Mr Hartigan, I accepted the invitation.
The government's accused News Limited of bias and inaccuracy in its coverage of the carbon tax debate, and the Prime Minister's threatened tighter regulations on media companies, setting the scene for a frank discussion.
It's a private meeting, but you would expect me to be talking about the government's reform agenda and my vision for the nation's future.
Much of that vision was once Kevin Rudd's.
Kevin Rudd had a vision that there was going to be a big change in health. He had a vision that there was going to be a single funder and ending the blame game.
Today, Julia Gillard turned that vision into reality.
Re-engineering the way that hospitals work.
Minus Kevin Rudd's dream of a single funder.
We will become an equal partner in the growth costs of hospitals.
That means the federal government won't take control of hospital funding as per Kevin Rudd's plan. States will keep control of the GST revenues they would have given up under his deal.
That set of transactions was not agreed with state governments and in my estimation was never going to be agreed right around the nation. So I have taken a different approach.
But the Prime Minister says today's deal still delivers the core of health reform that'll mean more cost-effective hospitals, lower waiting times and an extra $175 billion of Commonwealth funding over the next 2 decades.
I've been through all this before a couple of other times, so this is a repeat performance.
After 15 months of on-again, off-again deals with Canberra, the states are happy with Julia Gillard's deal, but the opposition says that's not necessarily a good thing.
She's capitulated to the states. They've got everything that they've asked for and the federal government have got nothing in return. All they're doing is providing more money and not solving the problems.
Doctors are also happy about the extra cash, but cautious about promises the deal would put an end to squabbles between Canberra and the states.
The only way the blame game is going to go down is if we know whose responsibility it is to fix a particular problem. That's where the transparency must come in. So that's what the AMA will be watching very closely.
Kevin Rudd's in hospital at the moment, also under close observation as he recovers from Monday's heart surgery. He'll be out of action for another 8 weeks, so he won't be commenting on the surgery performed by Julia Gillard on his healthcare plan. Tom Eagleton, Late Line.